is less than that of the aortic pressure. Again, you can see the ventricular pressure changes. You can see that there is the period of ejection starts at 80 millimeters of mercury in case of the left ventricle, whereas 8 millimeters of mercury in case of the right ventricle, and then it is going to eject the blood, rapid ejection for initial 70% of the blood, and the rest of that is actually passively or slowly ejected out. And when the pressure drops, there is closure of the atrioventricular valves. There is opening of atrioventricular valves and the closure of the aortic valves occurs. So this is how the ventricular pressure changes, they are taking place in the course of cardiac cycle. Now we have the term, after contraction we have ventricular diastole. Now this ventricular diastole is having different phases. First is the protodiastole, 0.04 seconds. Then we have isovolumetric relaxation, 0.06 seconds. Then there is period of rapid filling, 0.11 seconds. Slow filling or diastasis, 0.20 seconds. Atrial systole, 0.11 second. And collectively this is actually around 0.52 seconds. Now protodiastole. First phase of ventricular diastole is named as the protodiastole. This is a short phase. The ventricular pressure falls. The pressure becomes less in ventricles than in aorta and the pulmonary artery. Some blood flow continues from left ventricle into aorta because of momentum. Although the ventricle has stopped contracting, the velocity of the blood flow in the ascending aorta becomes almost zero in early diastole. The semilunar valves are closed at once and do not permit the backward entry any blood into the ventricles. There is some backflow of blood in the first part of aorta. An aortic valve closes, and with the closure of this valve, this phase ends. The total duration of this short phase is 0.04 seconds. Then comes the period of isovolumetric relaxation. Now what is it? Its duration is 0.06 seconds. When the ventricular pressure increases, when the ventricular pressure decreases, the arterial pressure, there is backflow of blood. And this backflow of blood is actually forcing the semilunar valves to close. The ventricular muscle is undergoing relaxation. There is rapid fall in the ventricular pressure. There is no change in blood volume as both valves they are being closed. When the left ventricular pressure becomes lower than the left atrial pressure, there is opening of mitral valve, and then this phase ends. The duration, as you know, is 0.06 seconds. Meanwhile, the atria fill up and atrial pressure gradually rises. Again, you can see the period of isovolumic relaxation. Isovolumic relaxation is being represented by V wave in JVP, which is due to venous return to atria from superior and inferior vena cava, due to gradual rise in atrial pressure when the blood accumulates in the atria because of closed AV valves. The top of V wave coincides with the opening of AV valves. The blood flows from atrium to ventricles rapidly and is causing descent of V wave. ECG is going to show us the T wave. Heart sounds. S2 sound is actually showing the closure of semilunar valves, normally split because aortic valve closes slightly earlier than that of the pulmonary valve. Aortic pressure curve incisura that is being seen when the aortic valve closes caused by a short period of backflow before the valve closes, followed by sudden cessation of the backflow when the valve closes. JVP is going to give rise to V wave due to venous return to atria from superior and inferior vena cava. And there is ECG is showing no deflections. The heart sounds, they are actually showing S2 closure of semilunar valves, normally split because aortic valve closes slightly earlier than that of the pulmonary valve. Then aortic pressure curve incisura when the aortic valve closes is being caused by a short period of backflow before the valve closes, followed by sudden cessation of the backflow when the valve closes. Now we have the diastole. Diastole is actually having the two phases. There is rapid inflow filling phase and there is a slow filling phase known as the diastasis. So rapid inflow phase or filling phase starts actually with that of opening of mitral valve. Now the blood flows rapidly from left atrium into left ventricle and the ventricle is undergoing relaxation, so no rise in pressure. There is 2/3 filling of ventricle. There is rapid phase filling remaining for 0.11 seconds. Then we have the slow filling phase of diastasis, the stasis during the diastole. In this phase, it appears that there is no blood flow from left atrium into left ventricle, and most of the blood which was in left atrium has already flown into left ventricle, as the mitral valve is open and small amount of blood returns into left atrium from pulmonary veins, and when this blood enters into the atrium, it directly goes into left ventricle. So both the left atrium and left ventricle, they act as a single chamber. So it appears no blood is flowing into left ventricle. And just the slight filling is occurring in this phase and duration is about 0.20 seconds only. Then atrial systole, the left atrium contracts to push the blood from its cavity into left ventricle. When atrial systole, ventricular systole is completed. The atria contracts towards the end of the ventricular diastole. Remaining 20 to 25% of ventricular filling occurs because of the atrial systole, and the duration is 0.11 seconds. As the atrial pressure falls, the atrioventricular valves close and the left ventricular volume is now maximum. That is the EDV. That is the end diastolic volume, which is about 120 milliliters in left ventricle. Again, you can see that after every 2 or 3 slides, this cardiac cycle is coming, because what we are actually learning about is just the explanation of all these curves, graphs, lines. So it is mandatory for all of you to learn it, how to draw it, and whatever thing is being asked, you can answer it easily. Ventricular filling, JVP is reflecting it by means of Y descent. Then heart sounds like S3, pathological in adults and is seen in dilated congestive heart failure, myocardial infarction, myocardial regurgitation. No, this is myocardial infarction. No, this is mitral valve incompetency, mitral valve regurgitation, severe hypertension, normal in children. There is presence of various pressure values, and you can see that we have right atrium ranges 2 to 6 millimeters of mercury. In right ventricle we have 15 to 25 millimeters of mercury. Diastolic is 2 to 8 millimeters of mercury. And in pulmonary artery we have 15 to 25, diastolic 8 to 15 millimeters of mercury. Left atrium is 6 to 12 millimeters of mercury. Left ventricle is 100 to 140 millimeters of mercury, and diastolic is 3 to 12 millimeters of mercury. Why I am telling you? Because these values, they are quite important for you to learn, and they're being asked that what is their value during the course of diastole or systole. So if you don't know the exact value, how can you draw it? Then we have the pressure changes, which are frequently asked and quite easy. That during the course of systole of the left ventricle, it may rise up to 125 millimeters of mercury. And the minimum pressure in the aorta during the course of diastole is about 80 millimeters of mercury. High pressure in the aorta during the diastole is the result of what is known as the elastic recoil of aorta. The aortic wall undergoes distension, storing the kinetic energy in the form of potential energy. The elastic recoil of aortic wall is responsible for making the circulation through the arterial system. So this is quite important for you all to know, that the aortic wall is undergoing distension, storing kinetic energy in the form of potential energy, and the elastic recoil later on is important for making the circulation throughout the arterial system. Now, the pressure changes in the aorta. The maximum pressure in the aorta during the systole of left ventricle is, remember always, and what is that? That is 125 millimeters of mercury during the diastole, and normally it is about, normally means that when it is not contracting, it is at rest. And what is that? That is the diastolic pressure, and that is 80 millimeters of mercury. Now, frequently asked, and I have just printed it myself today, that why? Because most of the students, they're being asked in Viva about, beta, define what is pulse pressure, and not even a single one is able to answer it. And what is it? The difference between two pressures is known as the pulse pressure. And what are those two pressures? Those two pressures, they are the diastolic pressure and the systolic pressure. So the difference between the two pressures is known as the pulse pressure. Now we should be knowing about the pressure changes in the left ventricle. We have isovolumic contraction, maximum ejection, reduced ejection, and protodiastole. So isovolumic contraction, at its start, the pressure in the ventricle is slightly above 0 millimeters of mercury, which is a result of atrial systole. The intraventricular pressure rises and the AV valves become closed. An abrupt increase in the pressure results, which may reach up to 80 millimeters of mercury at the end of this stage. Now, maximum ejection, the pressure rises still further and is going to exceed the pressure of the aorta, which is 125 millimeters of mercury. Pressure in the ventricles start falling. At the end of this stage, it becomes less than that of the aorta. Then we have protodiastole. Intraventricular pressure falls, resulting in the closure of aortic valve. Then we have the pressure changes in the left ventricle during the course of isovolumetric relaxation. There is steep fall in the pressure of right ventricle during the course of rapid inflow, reduced inflow, and atrial systole. the pressure in the ventricle falls, pressure changes in the right ventricle, and the maximum pressure developed over there in the right ventricle, that is the 25 millimeters of mercury. Then we have the volume changes in the ventricles during the course of cardiac cycle, which is one portion you can see. At the start of ventricle systole, the ventricles, they are full of blood, having the end diastolic volume of about 120 to 130 ml. During isovolumic contraction, there is no change in the blood volume, and the maximum ejection, that is the 2/3 blood volume, is ejected out, and slow ejection 1/3 is ejected out. So stroke volume is ejected out in ventricular systole, and the 70 ml of blood that is left behind, that is the end systolic volume, that is 50 ml. Out of 120, 70 is left and 50, that is the end systolic volume. Isovolumic relaxation, no change in blood volume occurs, and there is rapid filling, 2/3 filling occurs, and diastasis, only slight filling occurs, and the remaining 20 to 25% filling occurs in atrial systole. By increasing the end diastolic volume and by decreasing the end systolic volume, the stroke volume can be increased. End diastolic volume depends upon venous return, and end systolic volume depends upon contraction of ventricles. We should be knowing this very clearly, that the end diastolic volume depends upon the venous return, the blood that is coming to the heart from veins, and the systolic volume, which is actually being given out from the heart, is actually depending upon the contraction of the ventricles. So you can see the volume changes, how much that is around the volume, how it is in systole, how it is in diastole, and this is how it actually is being made stepwise. This is actually the volume pressure diagram, which is being produced between left ventricle volume and left intraventricular pressure, and this is actually showing us the opening of mitral valve, closing of mitral valve, opening of aortic valve, and opening of aortic valve, and closing of it. It has the period of filling, period of isovolumic contraction, period of ejection, and period of isovolumic relaxation. So we are going to discuss them one by one. The period of filling, this phase in the volume pressure diagram, begins at the ventricular volume of about 50 ml and a diastolic pressure of about 2 to 3 millimeters of mercury. The amount of blood that remains in the ventricles after the previous heartbeat was only 50 ml and is known as the end systolic volume. As the venous blood flows into the ventricle from left atrium, the ventricle volume starts to increase up to 120 ml, which is called end diastolic volume, and increase of 70 ml occurs from point A to point B. You can see from point A to point B. Then we have the period of isovolumic contraction. During isovolumic contraction, the volume of ventricle does not change because all the valves, they are closed. However, the pressure inside the ventricle increases to equal the pressure in the aorta at a pressure value of about 80 millimeters of mercury and is depicted by point C. Period of ejection. During ejection, the systolic pressure rises even higher because of still more contraction of the ventricles. At the same time, the volume of the ventricle decreases because the aortic valve has now opened and blood flows out of the ventricles into the aorta. Therefore, the curve labeled 3 or period of ejection traces the changes in the volume and systolic pressure during this period of ejection. Then phase 4 is the period of isovolumic relaxation. At the end of period of ejection, point D, the aortic valve closes and the ventricular pressure falls back to diastolic pressure level. The line labeled 4 traces this decrease in intraventricular pressure without any change in volume. Thus, the ventricle returns to its starting point with about 50 ml of blood left in ventricle and at an atrial pressure of about 2 to 3 millimeters of mercury. So again, you can see how the ECG that is being represented by the different phases in the cardiac cycle. You can see period of isovolumic contraction, there is ejection, isovolumic relaxation, there is rapid inflow, there is diastasis, the atrial systole. So it is very important to learn how to draw it, how to define it, what are the different phases, and then segmental dissection of all individual portions of the cardiac cycle along with explanation. That is very, very important. So I hope all of you are getting my point to learn this by heart, how to draw it. So if you're not even remembering it at the time of your exam, if you know the diagram, you can attempt the question very, very easily. So dear all, stay blessed. Allah Hafiz.